When it comes to life-saving medical treatments, the price of health can be staggering. From advanced surgical techniques to cutting-edge therapies, some procedures come with astronomical costs that reflect their complexity and the expertise required. For those facing serious conditions, these expensive medical interventions can mean the difference between life and death. In this video, we explore the top 10 most expensive medical treatments, shedding light on the financial burden that comes with these critical yet life-saving procedures. Before we begin, please like and subscribe to our channel and stick till the end. Number 10. Spinal Fusion. Average treatment cost, $115,000. Spinal fusion is a major surgical procedure used to address conditions such as spinal instability, degenerative disc disease, or spinal deformities like scoliosis. The surgery involves permanently fusing two or more vertebrae to eliminate movement between them, providing stability and pain relief. The average cost for spinal fusion surgery is around $115,000, though it can vary widely depending on the complexity of the case, location, and specific techniques used. Costs also include preoperative imaging, surgeon fees, anesthesia, and postoperative rehabilitation. Despite its high price, spinal fusion can dramatically improve quality of life for patients suffering from chronic back pain or spinal disorders, allowing for better mobility and reduced discomfort. Number 9. Exploratory chest surgery. Average treatment cost, $137,533. Exploratory chest surgery is a critical and often emergency procedure performed to investigate and treat life-threatening conditions involving the heart, lungs, or surrounding organs. This type of surgery is usually conducted following trauma, severe infections, or unexplained chest abnormalities. The cost, averaging $137,533, reflects the complexity of the procedure, the need for specialized surgical teams, advanced equipment, and comprehensive postoperative care. Often, the surgery involves opening the chest to locate and assess damage to vital organs, making it one of the most invasive and expensive medical interventions. Despite its high cost, exploratory chest surgery can be life-saving, providing critical insight and allowing for immediate intervention in severe cases. Number 8. Aortic valve replacement. Average treatment cost, $170,000. An aortic valve replacement is a critical surgical procedure used to treat severe aortic valve diseases, such as aortic stenosis or regurgitation, which can lead to heart failure if left untreated. The average cost of this procedure is around $170,000, though it can vary depending on whether it is performed through traditional open heart surgery or the less invasive transcatheter aortic valve replacement method. The complexity of the surgery, the advanced devices required, such as artificial valves, and extensive postoperative care contribute to the high cost. While expensive, AVAR can significantly extend life expectancy and improve the quality of life for patients with life-threatening heart conditions. Number 7. Small bowel transplant. Average treatment cost, $275,000. A small bowel transplant is a highly specialized and complex surgical procedure, typically performed on patients with severe intestinal disorders, such as short bowel syndrome or Crohn's disease, when other treatments have failed. The cost of this procedure averages around $275,000, but can exceed $1 million depending on post-surgery complications and the need for extended care. The surgery involves transplanting a healthy small intestine from a donor into the patient, and it requires careful monitoring and lifelong immunosuppressive medications to prevent rejection. Though expensive, a small bowel transplant can be life-saving and significantly improve the quality of life for patients who otherwise depend on total parenteral nutrition to survive. Number 6. Intestine Transplant. Average treatment cost, $275,000. An intestine transplant is one of the most complex and expensive medical procedures, costing around $1.1 million. This procedure is usually performed on patients suffering from irreversible intestinal failure, often caused by conditions like Crohn's disease, short bowel syndrome, or other severe gastrointestinal disorders. The surgery involves replacing a damaged or non-functioning intestine with a healthy one from a donor, and it requires a highly skilled surgical team and intensive post-operative care. Lifelong immunosuppressive medications are necessary to prevent organ rejection, significantly adding to the overall expense. Despite the substantial cost, this life-saving procedure offers a significant improvement in quality of life for patients who might otherwise rely on total parenteral nutrition or face life-threatening complications. Number 5. Pancreas Transplant. Average treatment cost, $347,000. A pancreas transplant is often performed on patients with severe type 1 diabetes who experience life-threatening complications, such as kidney failure or difficulty managing blood sugar levels. The average cost for a pancreas transplant is around $389,000, which includes the surgical procedure, hospital stays, and long-term post-operative care. The surgery involves replacing a diseased pancreas with a healthy one from a donor, allowing the patient to produce insulin naturally again, potentially eliminating the need for insulin therapy. Patients who undergo this procedure also require lifelong immunosuppressive medications to prevent organ rejection, which contributes to the overall cost. Despite the high price, a pancreas transplant can greatly improve quality of life and help patients achieve better long-term health outcomes. Number 4. Kidney Transplant. Average treatment cost, $442,500. A kidney transplant is one of the most common organ transplants and is performed on patients suffering from end-stage kidney failure, often due to conditions like diabetes or chronic kidney disease. The average cost for a kidney transplant is approximately $442,500, which includes pre-transplant evaluations, the surgery itself, hospital stays, and post-operative care. After the surgery, patients must take lifelong immunosuppressive drugs to prevent the body from rejecting the new kidney, adding to the long-term costs. Number 3. Liver Transplant. Average treatment cost, $812,500. A liver transplant is a crucial and life-saving procedure performed for patients with end-stage liver disease or liver failure, often caused by conditions such as cirrhosis, liver cancer, or hepatitis. The cost of a liver transplant averages around $577,000, but it can vary based on the complexity of the case, the hospital, and the duration of post-operative care. The procedure involves replacing a diseased liver with a healthy donor liver, which requires a specialized surgical team and a long recovery period. Post-surgery, patients must remain on lifelong immunosuppressive medications to prevent organ rejection, and they often require frequent follow-ups and monitoring, all of which contribute to the overall cost. Despite the high price, liver transplants offer patients a chance at a significantly improved quality of life and long-term survival. Number 2. Lung Transplant. Average treatment cost, $929,600. A lung transplant is a highly complex and life-saving procedure, with costs averaging around $1.2 million. This surgery is typically performed on patients suffering from end-stage lung diseases such as chronic obstructive pulmonary disease, pulmonary fibrosis, or cystic fibrosis. The high cost is attributed to several factors, including the intricate nature of the transplant itself, the lengthy hospital stays required both before and after the procedure, and the extensive post-operative care. Patients must also take lifelong immunosuppressive medications to prevent rejection of the donor lung, which adds to the overall expenses. Despite the high price, a lung transplant can drastically improve the quality of life and survival prospects for those with severe lung conditions. Number 1. Heart Transplant. Average treatment cost, $1,500,000. Heart transplants are among the top most expensive medical procedures globally, with average costs exceeding $1.6 million in the U.S., covering pre- and post-transplant care, hospital charges, organ procurement, fees, and medications. Private insurance typically covers most costs, but secondary insurance may be necessary. Medicare also covers heart transplants, albeit with coinsurance and deductibles. Transplant centers often require proof of payment or insurance coverage before listing patients, and post-transplant care and lifelong medications add to expenses. comprehensive insurance coverage or alternative funding is crucial for accessing this life-saving treatment. If you found this video valuable or want to learn more about healthcare, medical advancements, and other health-related topics, make sure to like this video and subscribe to our channel for more in-depth content. Stay informed and take charge of your health journey.